Yasmin's an amazing healthcare support worker. She takes the time to get to know the patients, to find out what's important to them and what makes their days better and brighter. She always has the time for her colleagues, and she also has the time to make sure that the team work together and provide better outcomes for our patients.
I think it's the relationship she builds up with the relatives as well as the patients, especially at end-of-life care. The patients appreciate all the little things that she does for them. It's those little things that make the patients stay more comfortable.
There are little things that I do for people, and that could just be the fact of giving somebody a shower and hair wash. And the thing that I get out of that is that they've got a huge smile on their face, they're calm and relaxed, and I actually feel that I've achieved something and then can go off and help somebody else. We get a family to support as well, and I like to do that because to them it shows that they've placed their loved one in our trust and care.
Alan is amazing because he's a very quiet soul. He comes in, he finds out what's going on, and off he goes around the ward, and he quietly gets to know everybody. He will chat to people who he's known from one week to the next about how they've been. And he is just a very calming influence who can sit with people and just provide that sort of bit of companionship for people who might feel a little bit isolated or lonely or not feeling very well.
Basically, I try to do jobs that don't require the sort of training that the carers and the nurses have. Pushing the tea trolley around, serving tea and coffee to the patients, helping the patients fill out their menus for the following day. I'm not working to deadlines, so I have time to pause and chat with the patients while I'm making their cup of tea or while I'm doing their menu with them. And they like to talk.
We treat those that use our service as individuals. We recognise that when someone comes to us, they're scared, that it's not about food, it's about stuff that's going on underneath, and we support people to find a way to work out what's going on for them and find a path forward and hopefully recover from their eating disorder.
I view all my patients as persons first. I don't look at the condition. I look at them as a person.
I enjoy the variation between day to day. You know, you don't ever get a day like each other. You know, you kind of wake up and there's always something different going on.
What I really enjoy is when I work with my patients and they got any challenges and they overcome it, even the tiniest of challenges, and they have a positive outcome.
I nominated Andy Dean because I feel that he goes above and beyond, not just with patients, relatives, but also with staff. He's always got time for everybody, even when he hasn't.
Andy is caring and compassionate. He's just kind to everyone, never has a bad word to say.
I nominated him because he shows a lot of care and compassion on the ward with staff and with the patients. And last year when I went through a tough time, he showed a lot of compassion with me.
My role is working with the frail elderly. I spend a lot of time going out into the community to see people at home and dealing with people in the last stages of their life in the hospital. My golden rule is how would I want my mother or father to be treated in these circumstances, and I think if you have that at the back of the mind, you can't go far wrong. I feel that I work as a team and that it's the whole ward that is compassionate and kind, but I'm happy to be their representative.